Start. Yeah. Good evening to everyone. I welcome everybody for this very profound webinar. What we are going to do today on behalf of the World Health Day on Anemia Mukt Bharat, and we are privileged that the NSI Mumbai chapter is the one who is organizing the entire event with the core team members. And here I'm here to present about the NSI Mumbai chapter and the our headquarter National Society of India at NIN. What are the activities and what are the role they play for this various activities they play in this the entire seminar. Coming to the Nutrition Society of India, as we all you may be aware of it, that it is established in 1967 in an association of nutrition professional programmers, policymaker from India and abroad. The recognized Indian representative of International Union Nutritional Sciences, IUNS, is the adhering body of this Indian National Science Academy and the Federation of Asian Societies of Nutrition. This society is totally dedicated to disseminate the results of the latest research, especially in the community, and also the nutrition programs in the country, various they conduct, and also recommend the various strategies to promote nutrition in the community at the community level on a larger scale. Going to the next. What we do, what as a Nutrition Society of India and especially the Mumbai chapter do in the entire as a professional body of this National Institute of Nutrition. Mostly we target into the community outreach program where the nutrition, health awareness and the training programs are considered under these programs. Dissemination of the scientific information by conducting various seminar, webinars, workshops, conferences, and also the various publications we enhance, and the nutritional guidelines and the training manuals are created for the larger benefit of the society. We at NSI Mumbai chapter, one of the most active zonal chapter across nation, and this is our website www.nsimumbai.org. Go to the next. Benefits of becoming an NSI Mumbai chapter member or NSI member. You get the latest scientific updates, various publication NSI of NSI Mumbai chapter. Also, you will be given a chance to post the NSI Mumbai social media handles and opportunities to present papers at the various conference this society conducts, and the discounts are given to the students forum for certain conferences and seminar which are totally organized by NSI. This is our website, and you can go into this website to see the further detailed forum of this NSI chapter. So for more information, follow us on the social media. This is Facebook, YouTube, all our social media site, and our Insta handle is also there. And reach out at the given email for your further queries. Anybody can write an email to us, and if it is relevant, we will definitely give answers to your queries. Now I hand it over to Dr. Madhvi Sathe, who is the treasurer of the NSI Mumbai chapter, to take over the further session, and all the best for the entire session.
Thank you, Dr. Rupali, for introducing us to NSI and NSI Mumbai chapter and its activities. Now it is my pleasure to introduce Ms. Purbi Mahajan, our moderator for this afternoon session. Purbi is a registered dietitian. She is a senior clinical dietitian at the Tata Memorial Hospital, Mumbai. She has more than 22 years of experience in clinical dietetics, enteral and parenteral nutrition, and enterostoma therapy, which focuses on patients who have undergone ostomy procedures. Purbi has won awards for her paper presentations at the IDACON 2016 as well as 2018. She is a teaching faculty for the very prestigious International Society of Pediatric Oncology in Developing Countries Onconutrition Fellowship Program. She's also a visiting faculty at Dr. BMN College of Home Science and SPT College, Juhu. She has been invited as speaker and resource person at various national and international conferences. She is the joint treasurer at IPEN India Mumbai chapter, as well as the honorary member of the working committee of the Dysphagia Core Group, IPEN India. And she's our own local executive committee member at NSI Mumbai chapter. And to top it all, she's a certified FODMAP dietitian from Monash University, Australia. So a warm welcome to Purbi to take over and conduct this session for us on Anemia Mukt Bharat. Welcome, Purbi.
Thank you, ma'am. I welcome everyone for joining us in the evening for this special occasion, which we are celebrating on for the World's Health Day, and the which is the theme going a healthy beginning and a hopeful future. As well as, so today's discussion, we will be concentrating on the critical issue on iron deficiency anemia, especially the aged children, which is of 2 to 6 years. And to begin with this discussion, we have our two eminent speakers with us, Dr. Eileen Kande and Ms. Bhakti Samant. Dr. Eileen Kande, with her wealth of experience spanning from 30 years, Dr. Kande has a deep understanding of nutrition and dietetics, as she heads the Department of Nutrition and Dietetics in Sir H.N. Reliance Foundation Hospital and Research Center. And in addition to being a respected member of the various professions and other associations, Dr. Kande has the privilege of serving in the key role that have further enriched her expertise and skills in the fields of nutrition. She's a valued RD board member of Registration of Board of India, that is the Indian Dietetics Association. She's also the EWC member of NSI's Mumbai chapter. She's a secretary of IPN Mumbai chapter and also the chief officer of IPN Transplant Corp Group. Welcome, ma'am. And our next speaker for the discussion is Mrs. Bhakti Sawant. She is the chief dietitian of Kokila Ben Dhirubhai Ambani, Mumbai, and she's the honorary joint secretary of IPN India Mumbai chapter, and also the chief coordinator for IPN ISPEN Training Center in Kokila Bai Dhirubhai Ambani Hospital. She's affiliated with a lot of life memberships of the IDA, ADE, IPN, ISPEN, NSI, and has many awards to herself as well as the publication. She's also a European ISPEN diploma in clinical nutrition, certified low food map diet counselor, as well as a certified keto diet counselor. Welcome both our speakers. And just to lay the platform, I'll just and just to start with the conversation, I may ask Dr. Eileen Kande, could you please briefly explain us what exactly is iron deficiency anemia and why is it particularly concerning for children between the age group of 2 to 6 years?
Thank you, Purvi, for that wonderful welcome, and thank you, Dr. Rupali Sen Gupta, Dr. Madhvi Sathe, and Neha, Chandni, Bhakti, and the entire team present here. And today we are definitely talking about a very important topic of iron deficiency anemia. And we are actually fulfilling the vision of most of our dietitians. Plus, it is such an important topic that even at the national level, the Prime Minister of this country has given so much of weightage for this Anemia Mukt Bharat, and that's where the term comes, Anemia Mukt Bharat, and we want India to be free. In order for India to be free, we need our babies, our little ones, to also be free of anemia. if they are free of anemia right from the beginning, and I'm sure our India will be anemia mukt. And in order to get anemia mukt, first of all, we have to know and understand that iron deficiency is one of the most common nutrient deficiencies, not only in India, it's all over the world. And there is a data which says that iron deficiency is definitely more prevalent in the younger ones, in the infants, the preschool children, even in the adolescents. And these include various reasons. Diet is also one of the most important reason, but there are other reasons like in an adolescent, there is an iron requirement because of bleeding issues, or there is an intestinal absorption issue. So, this iron deficiency can lead to many symptoms of anemia, and they do interfere with the development of the child, especially the neurodevelopment. Also, we find that there is today problems in hair, skin, nails. Some of them have gastrointestinal problems, and then we do not understand why. And if you look at the iron levels, you realize that our little ones are iron deficient. And I think that is a very, very vulnerable age. So we need to catch them young. Purvi, you're on mute.
Yeah. Thank you so much, ma'am.
Yeah.
So just to add on to this, Ms. Bhakti, could you just elaborate on the current statistics, regarding the prevalence of anemia deficiency, especially in the younger children within our community and particularly amongst this vulnerable group?
Yeah. So when we look at statistics, let's look at what we have, the statistics from our National Family Health Survey, which was conducted between 2019 to 21, which is the latest survey. And as per that survey, we have almost 67% of children between the age group of 6 months to 59 months, that is up to the age of 5 years, the prevalence is 67%. And what's even more shocking is that the same data, which was published a year before, or the series before, which was 2015 to 2016, at that time the prevalence was 59%. So, in just a span of 5 years, the prevalence has jumped. There's been a stark rise in the prevalence, and there's been an increase in almost 8.5%, which is alarming. And what we see is that there are strategies, government is trying to work at it, but I think there needs to be way more strategies. And amongst this survey, what was really highlighted about some certain key areas, so we would think of maybe only a rural area where it is affected. But as per this survey, the prevalence in urban children was almost 64%. And when you look at rural children, where we consider they are more vulnerable, was 68%. So it is across all. And what is interesting is that at a state level, if you see, where Gujarat, Tripura, Jammu, Kashmir, they were almost somewhere around 79 to 78% prevalence. And the lowest prevalence, according to the survey, the lowest prevalence was in Kerala, which was 39%. So we are saying even 39% is low. 39% itself is still quite high. And the only, what you say, the assumption or the indicating factor here would be maybe why Kerala has a lower percentage versus the other states would simply be maybe the nutrition education or the better healthcare access. So definitely when we're talking about this vulnerable population, we are looking at children majorly coming from low income families. So they are, because they are deprived of certain diversified foods, they don't have the facility to undergo regular health checkups. So definitely there is where there's a maximum risk. And I think that is the reason why all of us are over here, because even the government of India is taking a lot of measures. Why this Anemia Mukt Bharat initiative was, initiated by the Poshan Abhiyan. Everything is so that we can actually reduce anemia, or at least the prevalence of anemia, at least by 3% every year. And we're not talking only in small children, but all across the population, we need to achieve that. And though we are doing a lot of strategies, but I think a lot more needs to be done, because I feel there is a gap in the awareness programs versus the actual implementation of these strategies. So yeah, over to
Yeah,
you.
right. So just to continue with this, the same way as you said, and as right as Eileen ma'am said, just to more elaborately explain regarding, what is the impact of anemia in especially in this group for their physical and cognitive development, of this age group which goes. So
See,
anything that
when we're looking at this age group, I think this is the age group where there is a growth spurt happening. There are developmental changes happening in the child, and because of iron deficiency anemia, it is going to impact both, not just the physical development of these children, but also the cognitive health of these children. Coming across symptoms like maybe leading to fatigue, weakness, compromised immune function, and children become more prone to infections, and I think most of the time it's taken as a very natural thing, right? Kids going to school, oh, they end up getting infections, so we consider that as very normal. So I think it should just be given a lot more importance, and we should try and find out the root cause amongst it, because when we say there are clear cut research data which is quite there's a lot of data studies which is showing that there is, especially in cases with iron deficiency anemia, in these kids, we are seeing a delayed cognitive development where it is going to affect their attention span, their intelligence, their sensory perception. So, and yes, there are also longitudinal studies available in children, especially with anemia. When they have anemia in infancy, they are going to continue to experience a poor cognition even during their school days, in school achievements, or even having behavioral problems. So I think catching up this age group is very, very important, because it is having a very long term impact on these kids' health.
Yeah, so I would just rather like to ask both of you all that is there any anecdote from your work that you all must have seen to illustrate these impacts? As both of you all have uh, pediatric OPDs, so somewhere that you have particularly seen these cases in behavioral issues or learning difficulties, anybody coming to you, just to highlight a few.
Yeah, so actually speaking, you know what, Purvi, we are all practicing, but many a times you have to
Exactly.
understand, not many kids are going to be coming to dietitians. Parents would usually take kids to doctors. They will do their routine checkup, their growth chart analysis, and yeah, that is it. They'll do their routine, whatever vaccinations they are supposed to take, until and unless they have a health issue. And even for that health issue, like we have kids at home, and we never think of taking a child to a dietitian. We always think of taking our children to a doctor. That okay, there is fatigue, there is weakness, chalo doctor ke paas leke jao, or there is loss of appetite, doctor ke paas leke jao. And I think somewhere we consider these symptoms a very normal thing in kids. Kids are bound to be fussy, they are bound to be irritable, that is a part of their growing phase. So according to my practice, or according to what I have observed in reality, a lot of times this is underdiagnosed. So I think I would want if Eileen can elaborate a little bit her experience on this.
Yeah. So when the kids come with parents, sometimes they usually come for other reasons. So
Yeah.
they don't usually
Yeah.
come with anemia, but like fatigue or unable to play on the playground or feeling too tired. These are some of the signs and symptoms. And then I casually ask the mother, have you, checked the iron levels of your kid? And the usual answer is, yeah, long back, it is not frequent, we don't do a test. So in fact, in my clinic, I have one, meter where we are doing the study basically for kids on between 2 and 6 years. So I keep it is like an oximeter. It is a small little thing that just enters into the the index finger of the kid. And I just place that there, and I get the hemoglobin level immediately. I don't have to do a blood test for that. And they are so excited. The parents are, the mothers are and fathers are like very excited. Oh, you got the hemoglobin even without us pricking the kid. So they get very excited that, they got to see the hemoglobin. Immediately we get a report of the hemoglobin, which comes like on the oximeter, how you have something which will reveal it is 10 or 10.6 or 11. And then that really helps me to give a good counseling to the patient itself. In fact, we are, since it's a study, we are doing it with a lot of schools, and we are looking in fact, I would really welcome if any school or any community is willing to do this anemia test for these kids, especially we are doing it between 2 and 6 years. And we are giving them, like lectures and talks with regards to what they can eat, what is beneficial to them, and how they should know what their number is. Because there are many kids who are then detected with either minor or traits thalassaemic, because if they are continuously having a low hemoglobin, then we send them for iron studies. And that's when we understand that, oh yes, this is a thalassaemic minor. And then the advice is different, because in a thalassaemic minor, we don't give an iron advice, we give the other advice, the other way around. So counseling such children and their parents is also very important.
Just to add one
Yes,
point,
ma'am. Yeah,
just
yeah,
one point would be that
yeah.
though kids don't always come to the dietitian for iron deficiency anemia, but I think there needs to be a lot of education or propagation done amongst parents or caregivers as to how to catch the symptoms of anemia. So, like the basic thing we all know, there will be fatigue, there'll be weakness, there'll be shortness of breath, the skin will be pale. But over and above that, also there are a lot of symptoms which can be caught hold of. Like if the child is falling sick frequently, there is a delay in the growth and development of the child, whether you talk about the motor development or you talk about the cognitive development, where the child is lagging behind, compared to the other kids. There can be loss of appetite or lightheadedness, dizziness, cold hands, feet. These are all very common symptoms which, if they are present, can be caught. And I think one of the most common thing, pica, where there is a craving where the child will end up eating, maybe is eating too much of ice or clay or soil. So I think we need to propagate this more amongst the community, for even the caregivers to become more alert, because only then, only if the caregivers are alert, will the diagnosis happen, early. So I think just wanted to add that part.
True. So, Eileen, ma'am, can you just share a few insights on some of these dietary sources for iron that are particularly beneficial for these young kids? That is, are there any notable differences between the plant-based and the animal-based sources?
Theory wise, yes, I can give you that insight. But the most common thing that I get from my patients is that I give pomegranate juice and I give beetroot juice every day to my kid. And I give one apple per day in the tiffin, because I need the hemoglobin to increase. And then my education starts. I said, giving apple or giving pomegranate or beetroot is very good. You can get fiber, you can get other nutrients, you can get vitamins, which is also very good for the absorption of iron. But remember that when we look at iron rich foods, there are certain foods which are, in two categories. So I get a lot of vegetarian patients because I sit in a vegetarian setup. However, when I'm explaining to patients and I tell them that there are two types of, iron sources that we look at. Of course, we look at the heme sources. Heme sources means I explain to them and tell them that heme comes from the animal source, where where the iron is a little different in terms of absorption. So heme sources ions do absorb easily. You can get it from, if the kid is, or if the person is deficient, then I say you can eat one piece of liver, once a week at least, because liver is the highest source of heme iron. And they find it very easy. I said, okay, one piece of liver, which we can make a liver patty, or we can make a little, boiled liver kebab or something. I can easily give that. So then I also tell them you can give an egg. Okay, you can give, if they are vegetarians, then I give them sources from vegetable sources. So whilst I encourage them to eat a lot of greens, so green leafy vegetables, not only spinach, okay, but I tell them all the greens these days. Uh, People are coming to me with fancy names, they say, oh, we eat kale and we eat parsley and radish, and I tell them, okay, you can just go ahead with it. Also introduce dill leaves, introduce amaranth leaves. So these should not be forgotten in the diet. And probably I also give them certain recipes where they do a combination in such a way where they make like an iron rich laddu, which can be given as a tiffin for the kids, or it can be given even for adults who can take a mixture of seeds. And when I tell them that you can take a garden cress seeds, so usually people don't know what garden cress seeds are. And so of course, I give them the local name. I tell them how to make halim laddus, and how to use a garden cress seed. And when they actually find search on Amazon, and it's very easily available, I said this will be available with your local grocery also. Just go and check it out. So uh, they may know that okay, these are iron rich foods, but sometimes they don't know the recipes. So I do tell them that you can add these things, make different things out of it. Also add some dry fruits to it. Dried coconut can be added, grated dry coconut. Also, they can add pumpkin seeds and fruits like dried raisins, or a little bit of organic jaggery if they are able to get, and we make good stuff which they can eat. I also tell them that with iron, you need to absorb in your body. So you need vitamin C, you need a acidic environment. So, don't give a calcium and an iron together. Give it at separate times, because most kids are taking calcium as well. Then I also look at vegetarians if they are B12 deficient, right? So you could be dealing with other kinds of iron deficiencies. It could be not only iron deficiency, it could be B12 deficiency, vitamin C deficiency, uh, deworming issue. So there are many ways in which we can include iron rich foods, because the requirement for iron is not that great. Even if a little amount is had in the right manner where it is absorbed well, like no tea, coffee with iron. So that is the major thing, that they can easily get normal iron from food without taking supplements if it is not required.
True, ma'am. But so as we are, as right now we are live and we are outreaching a lot of parents also who must be listening to us. So can you just emphasize a little more upon, what is the recommended dietary allowances dietitian says on, for these 2 to 6 year old, and how will the parents ensure that their children are meeting these requirements?
So actually, the recommended dietary allowance is very little, 8 to about 11 mg per day. So that can be easily got, even if you add just one bowl of spinach. If they don't want to eat spinach directly, they can mix it with like make a spinach rice or a spinach. The other day I was looking at a very interesting recipe of a quinoa spinach, you know. So somebody made a quinoa upma and added a puree of spinach blend to it. It was really quite a good recipe. I saw it on Instagram though. Nevertheless, we at our center, we have made small little booklets where we tell the parents that include these foods with iron rich foods, that's the vitamin C rich foods. We also have looked out for certain foods that are already fortified with iron, right? So some
Yeah.
cereals are there, they are already fortified. If they can, we look at things that are affordable, cheap, and available. I don't want them to go like searching for things which is difficult to get. And also, as Bhakti rightly pointed out, to encourage and teach the parents to actually look at the signs and symptoms of anemia. That is, actually, you can make out if you check out the nails, the whitening of the nails, you look at the lips, you look at the pallor of the skin. All these things are quite will give you quite an idea of whether the hemoglobin is low, or you need to add something else.
Right. True. So, as we know the sources, now I just wanted to ask that, Bhakti, can you just tell us what will be the challenges, these families will be facing in providing iron-rich foods, that is how collectively they can help over these barriers. Like you have, so how, what will be the challenges there?
Okay. So, when we talk of challenges, I think one of the major challenges that you need to first diagnose. That is one part. Once that you have diagnosed, but I think there are a lot of challenges which we come across even as dietitians when we are trying to correct. One can be if the child is very fussy or if there are too many dietary preferences, that okay, vegetarian, maybe vegan, or eliminating certain food groups. The child would not want to eat certain food groups. That is one major challenge where you have fussy eaters. There are also sometimes certain cultural preferences, or certain cultural practices. So that is another challenge. Like Eileen spoke about some sources which are very easily available, and it's very easily available in the market and very easy to incorporate in the food. But for some communities who might have never heard about these products, they would not even want to try those products, saying कि अरे हमारे में तो हम ये सब खाते ही नहीं है, right? So that is the biggest challenge that we have to overcome. And I think where we look at a lower socioeconomic group, it is more about trying to give them more of a diverse diet, right? So it is about giving them a balanced meal, but to add more diversity. That becomes a challenge when you are dealing with low socioeconomic group. And another, I think most important, like all of us are talking, and we are talking that creating that awareness, making the caregiver understand, explaining them what are the impacts of a child having iron deficiency, why you need to take it seriously, because it is not about some few milligrams of your hemoglobin low in your blood. It has a lot of repercussions, or it has lot of effect on the overall health and well-being of the child. So I think that awareness, and then comes the awareness about the iron rich foods, how to incorporate these foods. So these I feel are the major challenges. Now, how do we overcome that? I think the only way out is to educate, educate, and educate. Do as many community reach out programs as possible, raise as much awareness possible. And I think we all are on that path. I think we, each one of us in our own capacities, are trying to do that. So I think that is the most important thing. And not just us, I think even the corporates realize that there is a gap. There are companies who are corporate companies also who have taken up these projects, and they feel that okay, we need to do something about it. Government is taking measures to do this. There are subsidies, or support provided by the government in for certain communities. Another very important or very interesting thing can be done is I think recipe demonstration or cooking demonstration. I think that interests everybody. So more than talking, I think if we have visual creations of these foods and how they can be incorporated, and even this visually appealing recipes, I think that will have a very big impact. So like maybe in your clinic, the ones who have their own clinic, and there is a facility where you can just display some few recipes of certain foods which are not commonly eaten and are iron rich. I think even that will have an impact. And even on social media, or even during the community reach out program, one is that we'll communicate, but the other, I feel, jitna impact, wo visual impact aata hai when you show something, when you show pictorials, when you show colors, I think that is more impactful. So I think I can think of these few things which we can do at our level, which can make a difference.
Yes, true, it can. And actually, it is very easy also. This is one of the practices that we do in our hospital in St. Jude's. That is, in the pediatric ward, we give a source of iron and ask the mothers who are staying there with their children to make one small item of their religion itself. So eventually what happens is within 2 hours, there'll be 20 different dishes, which is there, and each one teach one it happens, So it becomes, it's really good. It's a very practical, positive way of, spreading the awareness. So again, with this, as you rightly said, awareness and educating is very, very important. So in the modern world, we can see the advertisements which are coming up, where there is food fortification. So can you just emphasize more on, what exactly is food fortification, and how does it address the iron deficiency anemia, and how effective it is for our community in
So I
these
think
days?
there are a very interesting and promising projects which are coming up, which the government is, trying to inculcate. Though it's still lagging, I think we still need to do it, full-fledged. But yeah, food fortification is a very interesting way of trying to provide or add these essential micronutrients with what you're eating, and so there are two things. One is that you want to prevent deficiency. That is where the food fortification will come in. You cannot correct deficiencies once already set in just by doing food fortification. So, where we are talking about prevention is where the fortification will come in. When we are talking about to combat iron deficiency anemia, fortification along with supplementation is what is going to go hand in hand. So, like there is this project that is there, that is the double fortified salt, which is there, where the salts combine both iodine and iron, and it is a promising project, but where the studies indicate that if a universal distribution of DFS can be one of a very cost effective method to increase the iron intake and reduce anemia prevalence. Because here you have to talk about, understand one thing, that iron deficiency anemia, like even Eileen mentioned, there are multiple reasons for the deficiency to happen, and there are multiple factors which affects the absorption. And it's about not focusing on only the iron or the iron as a component. You need other components also along with it, like you also need protein, you also need vitamin C. So I think these fortification can be a really good way how it can go. And highlighting community, so maybe when we are doing to understand the prevalence, which are the communities who have the maximum prevalence, and then take up those communities and do these projects there. I think I did, while I was preparing for our session today, I did come across some studies which were conducted in Himalayan villages, where they found a micronutrient fortification of school lunches, which impacted, which helped to improve vitamin A, folate, and iron status amongst the school children. So I think these strategies are promising, but yeah, because we have a huge population, we need more hands to execute this and have a bigger impact.
Yeah, so when it comes to community, Eileen ma'am, I would like to ask you, what steps can we take as a community to raise awareness about iron deficiency anemia and its impact on this age group?
Yeah. Purvi, I think everybody, most of the people, whether it's government or people, are aware that there's a problem. In fact, this is not
Yeah.
only from now. I remember during our college days also, when we were doing this program of UNICEF, where we as student dietitians, we went to Dharavi village, and there we were asked to give that iron folic acid tablets to all the
Tablets.
yeah, pregnant women. We were like so excited to do that work, and we did it then, as well as now I'm currently running this little project with kids of school, where we use this oximeter to check just the hemoglobin, and we give them advice to them. Of course, this we do at a very small level, at our level, but nevertheless, the government has not turned a blind eye on this, because there are a lot of school programs that are conducted for anemia, workshops, seminars. Teachers are sensitized towards anemia. There are a lot of low cost or free health checkup clinics that do a regular checkup for iron, and they do distribute iron rich supplements to such people, pregnancy, and other vulnerable sections of the society, including promoting an iron rich diet. Besides the supplement or the fortification programs, we are basically advocates of this policy, and we cannot rely on the government to do everything. because somewhere down the line we have a responsibility towards our society, and we have a responsibility of creating an anemia mukt Bharat. And I think that goal, what was set in by our prime minister, we have to kind of see it through, and we all are the chariots of this mission. So we should do our best. You're on mute.
Sorry. So very true, ma'am. So as rightly as you said, so just to add on to this, Bhakti, could you really give few practical advices as we sum up to give the parents to incorporate this iron-rich, recipes into their diet to these little young ones' taste buds, the latest taste buds. The taste buds are changing now.
Yes, yes, definitely.
So how will
I
you
think for
incorporate
this
few
entire
tips?
conversation that we had, we did give out a lot of tips which can be incorporated. So, first and foremost, yes, today's generation, the kids want everything which is appealing to the eyes. If it's not appealing to the eyes, it's not going in the mouth. So, I think that is number one, to make the food appealing, add more color to the food, do different dishes. And I think very important is not to just try and focus on only the iron-rich food. We have to understand to club that iron with protein. So, like when we are talking about, say, spinach or spinach parathas, you have to make sure that it's not spinach paratha, but spinach paneer paratha. There is some form, or give the paratha with the curd or a raita where you are complementing the food groups. Um, uh, Beetroot raita. So I think we as dietitians or as parents at this era, we need to be more and more innovative when it comes to food. But that's the irony, because we are busy working. But yes, that is something very important. It can be incorporated into different snacks, like she mentioned about dry fruits. So different types of dry fruits in combination with raisins, apricots can be made into a laddu form and given to the child. Some chickpea snacks can be made, roasted snacks or fortified cereals. Yes, we do have now in the market, though yes, there will be a little sugar content in these foods, but yeah, there are startups, there are products coming in the market. A lot of people are trying to do genuine innovation with the right kind of ingredients to come up with good fortified cereals. So one needs to read the label every time. That's very, very important whenever you are buying ready to eat foods or fortified foods, to read the label. You can blend these iron-rich foods in certain, favorite dishes that the child likes. Like if the child likes eating pasta or omelets, then maybe, certain these iron-rich foods can be blended and added as a sauce, or can be just chopped and added just to add color to the meal. And there are iron-fortified snacks, cereals, grains available, which can be incorporated, and yes, to pair it with the right amount of other micronutrients like vitamin C we were talking about, to not give additional calcium. ये हम normally करते हैं ना, every meal the child is eating a breakfast, उसके साथ दूध तो पीना ही पीना है. So especially if you are dealing with a child having these issues. So it was very interesting, because a lot of iron rich foods and a lot of calcium rich foods also, they are common, and they both are contradictory. You don't want to give both together. So there was a trick that in our college, ma'am said that जब iron को absorb कराना है तो lemon के साथ ले लो. जब calcium का you want the benefit of calcium, then don't make the environment very distinct for the iron. So there are pros and cons of both these things, but yeah, a lot of color and a lot of combinations in which it can be incorporated, made interesting for the child, and can be done very creatively.
Okay, then. So finally, Eileen ma'am, may I just ask you, as you had mentioned regarding this program that you are running, can
Yeah.
you give us more insights regarding, are there any more online programs or interventions which aim in reducing the iron deficiency anemia?
Correct. So it's of course these small little studies we do it at our end, a little bit from us, to contribute to the society. But at the same time, we are also encouraging, and we are looking at in fact, there was a program called the Pradhan Mantri Poshan Shakti Nirman. Previously, it was known as the National Program for Midday Meals in School, right? So now, of course, it was given to the government aided schools. So from class 1 to class 8, that is also being done. Then the ICDS schemes are also available. So if somebody wants to really do community work, they can join these schemes where, targeted public distribution system is looked at, where, they are using these systems to encourage children when they go to school. They get an iron rich food, and they get a supplement if required, to actually get rid of anemia, because it started in 2021-22, and they have an aim to have an anemia Mukt Bharat by 2026. And I think it has to go in full force now. And therefore, this is a very urgent need that we all contribute in a small level. The idea of getting recipes shown to children and create, it's like that 10 rupees that they don't mind buying that packet of chips which is easily available, but they will not buy one
Yes,
egg, so
right, true.
it is a question of, you have 10 rupees in your hand, whether you want to buy that single packet of chips which is the 10 rupeya wala, or you want to buy one egg to eat. So it's all the question of how you educate not only the children, you have to educate the parents as well, as to where you are going to use that 10 rupees.
Yeah.
And believe me, it really makes a lot of difference, because we were doing this project in this school called AK Munshi, and where when we explained, we had games with the kids and with the parents as well. So when we had these games initially, they had to choose between what they like and what they dislike, and they started liking all the ultra processed foods. Then after that, we gave them a lecture, and we gave them a talk. We taught them how it is important, the importance of hemoglobin, heme and globin, and heme rich foods, iron rich foods. After that, we did we play the game again with them, and then we were able to actually see that now they are choosing the right foods, and they understood that, yes, they rather choose an egg over the packet of chips, which cost the same. This game we played with the parents. So similarly, we played with the kids as well. So each one of us can contribute to an Anemia Mukt Bharat in our own ways. We only have to think a little out of the box.
Wow, true, true. So, ma'am, really thank you very much to Dr. Eileen Candy and Ms. Saman for sharing their valuable insights today. And we have one quick question from the YouTube, where
Can't
take of junk food items.
sorry.
Junk.
Any one of you can
So
take it. You all
actually, there's
both can
the concept
say
of
that.
junk is not right. There's no food called junk. It's so sad that we call our food junk. Food is food. Food is food, anyways. It's about how you eat it, how much you eat it, and how you choose it. If you choose foods which are ultra processed over foods that you need to eat on a daily basis, you are creating a wrong environment for yourself in the body. So rather than blaming the food and calling it junk food, I think we should look at our choices more than calling a food junk food. So it is our education system and what we want to choose from the right foods.
Bhakti, you would like to add on?
Can you hear me? And because the
Bhakti,
voice is
yeah,
cracking off
yes,
mine. Yeah.
yes,
Okay, yeah, no, I think Eileen very beautifully explained.
good.
There's nothing
Yeah,
like junk food. That's very true. When you're going to replace your regular seasonal daily foods with ultra processed and processed foods is where the problem comes in. But if there is an occasional intake of these foods and you stick to eating your normal foods the other time, definitely it takes you a long way.
right. So, with such illuminating conversation that we had today, I would really thank NSI Mumbai chapter, Dr. Rupali Sen Gupta ma'am, Madhavi ma'am, Neha Sanmalkar, as well as the entire team of NSI for giving us this opportunity to conduct the Anemia Mukt Bharat program, this event. And as I may summarize by the discussions that we had, is it's very crucial that we come together as a community to address these challenges of the iron deficiency anemia, especially in the younger age group which is there. And let's commit to implement on the knowledge we have gained today, and let's move towards a healthier future for all. Thank you very much.
Thank you, both.
Thank